Hello there, my name is Artur Valerievich and I teach anatomy. And today I'm gonna tell you about aorta, about the descendens part of aorta. What is the descendens of aorta? Go down, it's go through diaphragm, it go until your fourth lumbar vertebra. And there will be bifurcation and it's terminal part of aorta, and it divides on two common iliac arteries, arteria iliaca dextra and arteria iliaca sinistra, communis. So aorta have, so descendens part of aorta have like two parts. It have like part inside thoracic cavity, so it will called like aorta thoracica, and part inside abdominal cavity, it will called aorta abdominalis. Let's see what we have inside thoracic part. So inside thoracic part, aorta is situated backward in posterior mediastinum. All branches of thoracic aorta you can divide on two groups, on parietal and visceral branches. Parietal branches, they supply like walls of your thoracic cavity. Visceral branches, they supply like internal organs, viscera of your thoracic cavity. So if you talk about parietal branches, first of all, it's, as you can see, intercostal arteries. So this will be arteria intercostalis posterioris. They are posterior because we have anterior. This we have like 10 pairs of posterior intercostal arteries that's situated in intercostal spaces from 3rd till like 11th. Last one will be not intercostal, it will be subcostal. Arteria intercostalis posterioris. They go along with nerves and veins with the same name and supply these intercostal muscles. In the middle of intercostal space, it will made anastomose with anterior intercostal artery. Remember, it's the branches of thoracic internal artery. When this, as you can see here, arteria intercostalis posterior go back, like on the level of neck of rib, each intercostal posterior artery give this dorsal branch here. It calls ramus dorsalis. That go through intervertebral opening and give the spinal branch. It's very important because the spinal branch, ramus spinalis, it supply, as you can see, it supply end meninges of your spinal cord. It supply roots of your spinal nerves, and it also supply actually your spinal cord. As you can see, it gives this ramus medullaris segmentalis, it calls, that make anastomose with anterior and posterior spinal artery. This dorsal branch continue backward and divides on lateral medial branches that supply your deep and superficial muscles of your spine. Next, parietal artery, it's arteria phrenica superior. Superior phrenic arteries, as you can see, Netter didn't draw them here. These two, no, they will be left and right. These arteries go down to your diaphragm and supply your diaphragm, that's all. Visceral arteries, they will have the same name of the organ they supply. So if you in thoracic cavity you have bronchi and lungs, so we have this rami bronchialis, and go along with bronchi, enters lungs and supply your lungs. We have esophagus, so we have rami esophagealis here that supply your esophagus. Also you have heart with pericardium, so from aorta you have rami pericardialis that supply pericardium and heart, and rami mediastinalis. Rami mediastinalis that supply your numerous lymph nodes of your mediastinum and fat tissue. So aorta abdominalis. Again, aorta abdominalis begins on the hiatus aorticus of diaphragm and terminates on the level of 4th lumbar vertebra, where it divides on left and right common iliac arteries. So all branches of abdominal aorta, it divides also on parietal and visceral branches. And visceral branches also will subdivide it into paired and unpaired. So parietal branches of abdominal aorta, it's arteria lumbalis and arteria phrenica inferior. So here you have, like, it may be 4 or 5 arteria lumbalis. They similar to posterior intercostal arteries. They also supply like posterior and lateral wall of your abdominal cavity. And inferior phrenic artery. So we have arteria phrenica inferior sinistra and arteria phrenica inferior dextra. They laying on like inferior surface of diaphragm and supply diaphragm. But not only. As you can see, it gives numerous small branches to adrenal gland. We will talk about it later. It calls rami suprarenalis superioris. Visceral branches. All visceral branches of aorta. It's subdivided into paired and unpaired branches according to your organs. You remember you have some paired organs inside the abdominal cavity and unpaired. So if you talk about paired branches, first of all, it's arteria renalis. Remember big arteria renalis, renal artery that come to hilum renalis and divided on segmental branches and supply your kidneys, but not only. From renal artery there will be some small branches to superior part of ureter, rami ureterica, and as you can see on superior segmental branch, they give a lot of inferior adrenal branches, so it will called rami suprarenalis inferioris. Next, it calls arteria suprarenalis media because, as I told you, you have superior and inferior suprarenal branches, so it will have name only arteria suprarenalis media, middle. It came directly from aorta, and it will supply your suprarenal gland. And the last paired branches, it's arteria testicularis or ovarica. It depends on male or female. In this case, it's male, so this is arteria testicularis. If you talk about arteria testicularis, it go through canalis inguinalis to funiculus spermaticus and reach testis and supply it. If you talk about arteria ovarica, it will go through ligamentum suspensorium ovari, reach ovarium and supply ovarium. And also it gives ramus tubaris and ramus uterinus to the tube or to uterus. So it's all about paired branches. Pay attention on supplement of suprarenal gland, glandula suprarenalis, because it have like three sources of supplement. As you can see, it have rami supraglandularis superioris from inferior phrenic artery. It get rami suprarenalis inferioris from branch of renal artery, and it have arteria suprarenalis media directly from aorta. I guess it's main in this topic, it's unpaired branches. We have only three of them, but these three branches supply almost all your viscera of abdominal cavity. So they are truncus celiacus, celiac trunk, arteria mesenterica superior, and arteria mesenterica inferior. So here is these three unpaired visceral branches. And we will begin with this truncus celiacus. So celiac trunk, truncus celiacus, it also called tripus of Halleri. It was Albrecht von Haller, it was an anatomist who first described it. It's very short vessel. It divides on, as you can see, three big vessels. The smallest of them is called arteria gastrica sinistra, left gastric artery. Middle, it's arteria hepatica communis, common hepatic artery, and the biggest one, it's arteria splenica, spleen artery. If you talk about arteria gastrica sinistra, it's only give one branch, as you can see, ramus esophagealis for abdominal part of esophagus, and then it's laying on the less curvatura ventriculi minor, and supply it. Next, we have arteria splenica. This spleen artery, it's big, as you can see, it go along pancreas and reach hilum of spleen. While it go to spleen, it give a lot of branches. Also, I will talk about it later. Arteria hepatica communis. Common hepatic artery, as you can see, it go to the right and divides on two vessels. This ascendens like branch, it calls arteria hepatica propria. and this descendens part it will called arteria gastroduodenalis. So proper hepatic artery, arteria hepatica propria. First branch it can give, it's this artery, it's arteria gastrica dextra. It's right gastric artery. It's laying on less curve and make anastomosis with the left one. It can originate from common hepatic artery or it can originate from proper hepatic artery. It may vary. Proper hepatic artery go up and divides on two branches, ramus sinister and ramus dexter. Ramus sinister supply like left part of hepar, ramus dexter supply right part of hepar, and also it gives small branch to your vesicophalia, to your gallbladder. So this ramus cysticus that supply your gallbladder. Then arteria gastroduodenalis. Gastroduodenal artery go down beside superior part of duodenum, and there it will divide. As you can see, it divides in these two branches that go to the head of pancreas and supply pancreas, superior part of head of pancreas and duodenum. So they called arteria pancreata duodenalis superior posterior and arteria pancreata duodenalis superior anterior. And this one, third branch, is laying on the big curve of gaster, and it calls arteria gastroomendalis or gastroepiploica dextra, right gastroomental or gastroepiploic artery. So supplement of gaster. As you can see, gaster have a lot of arteries. First of all, on the last curve, cruratura ventriculum minor, we have anastomosis of left gaster artery and right gastric artery. Next, on the great curve, we have anastomosis of arteria gastroomentalis dextra, right gastroomental artery, and the left one, arteria gastroomentalis sinistra, that came from spleen artery, from arteria splenica. And also, as you can see, you have small branches that called arteria gastrici brevis, short gaster arteries that came also from spleen artery. So here is the supplement of your gaster. Here, on the level of first lumbar vertebra, from aorta, there is a region of arteria mesenterica superior. Superior mesenteric artery go down, it crosses like left kidney vein and enters like mesenterium and give a lot of branches. It supply almost all small intestine and half of great intestine. But the first branch of superior mesenteric artery, it's also a pancreatic duodenal artery that divides on posterior and anterior branches. So it will called arteria gastroduodenalis inferior anterior and arteria gastroduodenalis inferior posterior. And now we can describe supplement of pancreas. As you can see, pancreas also have very complex supplement, have a lot of arteries and from different sources. So if we start with the head of pancreas have a lot of sources of supplement. So from the up it have like arteria pancreata duodenalis superior anterior and posterior. From inferior side it have arteria pancreata duodenalis inferior anterior and inferior posterior from superior mesenteric artery. Then if you talk about body and the tail, it have a lot of branches that came from spleen artery. As you can see, it have arteria pancreatica or dorsalis pancreas and arteria cauda pancreatica that supply like body and the tail of your pancreas. So here is supplement of your pancreas. Mesenteric artery, superior mesenteric artery, it enters mesenterium and it give a lot of branches. As you can see, the branches that come to your ileum, they will have the same name, rami iunalis. Next, branches that supply ileum, rami ilealis. Next, it give this branch that come to your ileocecal angle. It calls arteria ileocecalis. It give a lot of branches that supply like a terminal part of ilium, it's a rami ilialis, and branches that supply cecum, rami cecalis, anteriors, posteriors, and it gives this small branch that go along in mesoappendix and supply appendix. It calls arteria appendicularis. That supply directly appendix vermiform. Next branch, it go to the right and to the colon ascendens, and it calls arteria coeliaca dextra. It divides on ascendens and descendens like branches that supply your part of cecum, colon ascendens, and colon transverse. And finally, last branch of superior mesenteric artery, it's arteria coeliaca media that go through mesocolon transversum and supply your colon transversum. So here we come to inferior mesenteric artery. So arteria mesenterica inferior, it's originated from aorta on the level of third lumbar vertebra, and as you can see, it divides on few branches. First of all, it's arteria coeliaca sinistra that divides on like ascendens and descendens branches that supply your colon descendens, colon part of colon transversum, and in this place, as you can see, it creates anastomosis with middle coeliac artery, with arteria coeliaca media. It's big anastomosis, and it have a eponymical name like Arch of Rioland. It was also anatomist who described it. It's the biggest arcade. Arcades, it's anastomosis between branches of mesenteric arteries. Next, it give sigmoid artery, arteria sigmoidea, that divides on branches, arcades, and supply a sigmoid colon. And finally, it's arteria rectalis superior, superior rectal artery that, as you can understand, supply your rectum. I guess that's all about this topic. Thank you for your attention. Subscribe to my channel, ask some questions, and see you later. Peace.